why doctors focus on disease, because they're trained to do that. Their job is to focus on disease.
Didn't you say once that it's not healthcare, it's sick care?
Actually, exactly what it is. We're not faulting doctors because the physicians are doing exactly as they are instructed to do, and the physicians are doing what they need to do to keep their license active, and they need to make a living. And if they don't do what they're supposed to do, they will be legally reprimanded, which can mean that they lose their ability to make money. This is a representation of how you guys get energy. So let's start off. You need Energizer batteries to run the engine, and your engine is your body. So whenever you eat, that's why I've got this man here eating, whatever he's putting in his mouth is going to be turned into sugar. We're not here to discuss whether that's good sugar or bad sugar. I'm just simplifying. Energy is in the form of sugar that then goes into the bloodstream. And then it's filtered throughout the bloodstream to go to all areas of your body so that it ends up in the cell. That's what this is at the bottom far right. Inside of the cell is where that energy is made. We have the blood sugar, has to go into the bloodstream, but you need this organ right here. This is called the pancreas. This organ is what's going to secrete insulin so that the blood sugar that's in these blood vessels will go into this cell in order to create the energy. There's the batteries. Mitochondria take blood sugar and turn it into energy. You eat to create some sugar in your blood. Your pancreas shows up with the hormone insulin so it can put it into the cell so the cell can make energy. Where is this energy going to go? It's going to go to power your muscles. It's going to go to your brain so that you can think. It's going to go to every orifice of your body and do all of the millions of things that go on every minute of your life that you don't even know about. Here's where the problem lies. Do you guys see? This teaspoon represents sugar. Inside of our body, we can only have, believe it or not, 1 teaspoon of sugar floating through our blood. If we have more than 1 teaspoon of sugar floating through our body, this insulin has to be secreted in greater amounts. And guess who does that? The pancreas. The pancreas will say, okay, we need to secrete more insulin because we have way too much sugar in the blood, and we need to move the glucose, the blood sugar, out of the blood so that we're not going to be toxic to the human body. So you guys can imagine, where is this extra sugar going to go? The extra energy that we don't use. It's going to turn into fat, correct? Because we know fat is a storage unit for the unfortunate occurrence if a famine happens. The body says, well, let's just take the extra sugar, turn it into fat, and we'll use it another time when there's no food around. The other place it's going to go is, let's say you're the Energizer bunny, and you're out there like my dad, a road bike cyclist, and you're riding your bicycle 125 miles a week. Well, that's where some of that blood sugar is going to go too. So you see where energy goes depends on your lifestyle. Let's say you continue day in, day out, every day, every week for years of sugar into the blood based on how you eat or how little you move. So what ends up happening is your body starts to say, okay, we're going to just work overtime. The pancreas is going to work so hard 24/7 to keep your blood sugar at that 1 teaspoon of blood sugar throughout your body. And what happens to the pancreas when that goes on? It can become inflamed, what we call pancreatitis. Itis is inflammation. This pancreas becomes inflamed. You may feel it, you may not, but this is not going to be a webinar about pancreatitis. It's just a mention I make because a lot of you who come in here have had a bout of pancreatitis in the past, to the point that some of you have come in here who've already had cancer develop in the pancreas because of the disease process that can go on when we don't intervene soon enough. Remember, if you have pancreatic cancer, it can be reversed. You just got to stop causing the problem that caused it to happen in the first place, which the body can do. But that's a topic for another day. When you have too much blood sugar, what does the medical industry call that problem? Yep, diabetes. That's when the medical industry steps in to say, hey, your blood sugar's too high. They'll put you on Jardiance, they'll put you on metformin, or they'll put you on any of the number of drugs for diabetes. Here's the problem though. The medical industry expects that your blood sugar levels will go slowly up over time in this fashion. This is just a very simple graph. From one area, it goes up to the next and it goes up to the next like that. That's a very smooth graph going up. That's how they think your blood sugar is going to go. Whatever number the medical industry decides at the time is a problem, that's when they're going to intervene. But here's the problem. I just told you that your pancreas will secrete insulin to move that blood sugar out of the blood and into areas of your body. And it does that in a hockey puck style. It keeps your blood sugar stable at that 1 teaspoon. You see like this? And it can do that for years, 10 years, 5 years, 15 years, 20 years. Your pancreas can be working overtime to secrete enough insulin to hide that excess blood sugar in every nook and cranny of your body until you're bloated, overweight, and diseased. Does that make sense to you guys, that this is the problem here, that this is not a graph that goes up exponentially like this? It's a graph that stays steady, 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 steady until bam, right here, what happens? The hockey puck graph. It just, the blood sugar shoots up, and here is where the blood sugar is high. This is when the medical industry steps in. They have not stepped in more than likely in this area because your pancreas was the hero. Your pancreas was in there taking care of you all of this time and hoping you would figure out what you're doing wrong before it gets to here. This hockey puck graph. So pretend that this is another graph that I'm making and it's just staying stable all throughout. Are you guys getting this concept of the hockey puck graph? Goes stable and then bam, hikes up. I put down here 5 years, 10 years, 15 years, 20 years. But it could be, based on your lifestyle, it could be 20 years, 25 years, 35 years. And who is it different for? My father, because he was out road bike cycling. So he was burning off the excess sugar, but he was still having his pancreas overworking. Let's say he starts off at 40 years of age, and then it's not until he's 80 that he has a problem, which, by the way, he had to have a 4-way bypass at the age of 83. Now, let's say my father was sedentary. Then maybe this starts off where he's sedentary at 20 years of age, and then he gets to this point here when he's 40. We've had 45-year-olds having bypass surgery. So see how all this comes together based on your lifestyle. So if you say, but wait a minute, Janina, I thought you said exercise isn't good for weight loss. And I'm correct still. It's not good for weight loss. Exercise is good to defer what's going to come anyways. Exercise can kick the can down the road for what's going to happen anyways. Because if you're not eating when you should and how you should, you're going to end up with disease no matter what you look like. That's the concept I want you guys to get. So this is why my father can go in to the doctors during these years and be congratulated by how good he looks, because the medical field is looking for this problem here, right here. Never going to happen until it's too late. And that's why medical industry is late to the game. They could be 5 years late. They could be 10 years late. They could be 35 years late. You go to your doctor, you get your blood sugar read, and then they give you this result. And many of you have seen this in your labs where they show the green area is good, the red area is bad. So the doctor may see you and say, oh, Mr. Jones, your blood sugar is fine, right? As long as it's between 65 and 99. But I just told you guys, it's not your blood sugar that's the problem. What could they have measured?
Insulin.
There you go. When a person is in this stage over here, 5, 10, 15 years, everything's level and copacetic. When they're in this area, this is when the cholesterol could go up. And that's when the doctor would say, Mr. Jones, blood sugar is good. You don't have diabetes, but your cholesterol is not good. This is kind of what happens when a person gets a blood test done. They might have this kind of reading where it says low, in range, or out of range. And the first thing that might happen before cholesterol is a problem is the good cholesterol's on the low side. Doctor may or may not say anything about that. At this point, there's no medication to raise HDL. But if there was a drug company that made a medication to raise HDL, you would have been put on that medication probably when you were 25 years of age. Total cholesterol, now you see it's high here. When it gets to this point, what does a doctor prescribe a patient? A statin, right? During that period of time where the hockey puck is level, where blood glucose is still fine, your HDL could be too low and your cholesterol could be too high. When you're living in the blue zone right here, pun intended, you know how we have people who say, oh, I live in the blue zone, where meaning that people live longer. You could be in the blue zone where you think everything is fine when these people who live in the blue zone end up getting cancer and they say, oh, it must be genetic or hereditary. No, it wasn't. It's because they hung out in the blue zone, didn't know that they had an insulin problem. But guess what happens when they get up to here? Medical society jumps in and now they have any number of problems. So let's go over the blue zone area. The medical industry measures disease markers, not functional markers. Insulin is a functional marker, but medical industry doesn't measure that. Disease markers are what they measure because they can prescribe medications or surgeries or treatments that spend a lot of money and are invasive rather than allowing you to just reverse the problem by lowering the amount of insulin that your body needs to produce, giving you a false sense of security. Just yesterday, I talked to somebody who said, oh, my doctor said all my biomarkers are fine. So then I asked him, then why are you on the phone with me? Oh, and then he went through the list of all the problems that he has. You can guess, high blood pressure, but the doctor said all of his biomarkers are fine. And why does he not consider high blood pressure a problem? Because now he's prescribing him a drug to stay on for the rest of his life. So for the doctor, problem solved, right? I gave you a drug, you stay on it for the rest of your life, and now you're out of here. False sense of security. What kind of health problems do you think come up in this area? How old were you when you had diverticulitis?
40 something.
You also mentioned that you had appendix issues.
About the same period of time.
That's what happens in this blue zone. So in this blue zone, I'm going to go start with the symptoms: poor sleep, tiredness, mood swings, learning problems, digestive issues, panic attacks, body aches, headaches, breathing problems, irregular periods for females, low sexual desire for females and males. These are just a handful of things that could go wrong during this period of time, but I'm going to guarantee you, most people do not go to doctors right away for any of these problems. They figure, well, something's just not right, but it's not enough to make me go to the doctor yet. Unless, of course, the headache is a migraine, right? Then that's debilitating. They may go see a doctor. Unless the breathing problem turns into where they cannot breathe and they need asthma inhalers and things. So now let's go to how the medical industry names these issues here. I'm going to start young. Colicky baby. If the mother gave birth to a child while she was insulin resistant, she's damn lucky she even got pregnant in the first place, because Mother Nature's not stupid to let someone who's insulin resistant have a baby. But let's say she had in vitro fertilization. Medical field steps in to help her be able to have a baby. So that baby may turn up colicky. The kid could have asthma. The kid could have allergies. The kid could have insomnia. The kid could have ADHD. The kid could have autism. The teenager could have anxiety. The teenager or the young adult could have depression, acne, eczema, gastric reflux. As you get older, low testosterone, migraine, seasonal affective disorder, atrial fibrillation, rheumatoid arthritis, diabetes. And by the way, can you tell that these diseases are now coming older and older, right? We're moving to the higher echelon of the age. Heart attack, stroke, cancer, dementia, Alzheimer's. These are all terminology that is related to a disease that the medical industry has defined. And all of these come with what? A medication, a surgery, a procedure. rather than having taken a look at that hockey puck, the stick part, the linear part, and saying, let's step in here and fix the problem, which Ron correctly stated was insulin was the problem, not the blood sugar. It was the amount of insulin. When it comes to this area, the amount of money that's available to treat all of the laundry list of problems I gave you, whether it be a pill, a potion, and when I say a potion, I mean supplementation, because I'm going to throw that in there too. Lots of supplement companies want to capitalize on our fear of what we have going wrong. So they want to prescribe you a non-FDA approved pill, in other words, which is a supplement. But there's a lot of money to be made. And unfortunately, guys, and therein lies the problem, which is why you guys need to be the CEO of your own healthcare and say, no, 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 no. We're not going to worry about these disease markers. We're going to focus on these functional markers. Now, this is what's wrong with the medical industry. They don't teach the functional markers to your doctor because the drug companies run the medical industry to make sure they keep their coffers filled with doctors that fall in line and continue to practice medicine the way that they want them to for their financial gain, but not for your financial health, which is why we have the most expensive healthcare and have the worst outcomes in the United States of America for a nation of means. We have the money, we have the smarts, we have everything at our disposal to do what this is, functional markers. But people who talk about functional markers get put out into the cold, taken off of Facebook multiple times. Some of my videos on YouTube also get taken off, which is why I give you guys in this course that are on my email list. I give you guys videos that I can't put out on YouTube because they get blacked out. I hope that the winds of change are going to happen and we'll be able to talk more openly about these things. But this is for you guys to know, because functional markers are what are going to keep you out of this area right up here. This is the area, part 2, that we're going to talk about next. So that we're going to talk about what happens in this hockey puck area when the blood sugar is high. We have David here, who is our example of a doctor wanting to put him on insulin. And now he's going to have the wherewithal to teach his doctor why insulin was a bad idea. And we also have Ron here, who, when he came in, the insulin markers were not red, but when he came in, the reason we didn't force the insulin, fasting insulin, to be tested is because he already had health problems that we needed to fix. So all we did was go for fixing those problems. And now he has insulin markers to show where he's come in the age of in the late 70s. And this is important because both David and Ron prove the body never gives up on you. The body is always right. And David, I'm happy to say we've come to full circle moments with both of you guys. If you're a man who's over the age of 50 and you want help getting your health problems under control and getting rid of belly fat without having to diet or exercise, then click the link below. It's my calendar. Get on there and you'll talk directly with me. Look forward to catching you on the other side.